Hi, good to see you once again. Jim Rhodes here with you in this series. Can I be very candid with you? When we look at the 3 leading causes of death in the United States, first it's cardiovascular. 1 out of every 2 of us die from a heart disease. Second is cancer. Cancer has increased from 1 out of 12 to 1 out of 2.2 as of 2004. That means our immune systems aren't very well armed, so good nutrition can certainly help there. And third, diabetes. And I'd like to talk a little bit about blood sugar issues in general. Again, isogenics doesn't cure any of the 3 diseases I've just talked about. It's not meant to cure. It's not a medicine. It's not a magic pill. What it is a food. What it's meant to do is nourish and balance the body so it has a better chance to do its own fighting, because that's what it was designed to do, and that's what it will do. And that's what I've seen it do. But people with a special challenge of blood sugar issue, particularly diabetes, okay? Type 2 diabetes is on the rise, as we know. It's well over 22 million here in the United States alone. But the real tragedy is suddenly we have 12-year-old, 8-year-old, 9-year-old type 2 diabetics. Almost in every instance, when I've looked at type 2 diabetes, it is lifestyle. Lifestyle affects our blood sugar levels so dramatically that we end up with this horrific disease that we didn't intend to get. What are the 3 factors? 1, we are eating too much of the wrong things. I'll come back to that in a second. 2, we're not getting enough exercise. And this is really important for anyone who is having an issue with blood sugar. And 3, we're eating too much at one sitting, even if it's good for you food. So the 3 things that I teach my friends, and by the way, I have over 1,000 friends with this particular issue who I've coached a little bit and helped. Now, number 1, you're always working with your doctor. You've got to. You're always keeping good records, your little diary, and you're probably measuring your blood sugar several times a day. And this is what's wonderful about this. Your success, you can expect, can be very spectacular. Usually it is. But if you don't do these 3 things that I'm going to explain, isogenics is just another food in the many. Okay? 1, you've got to, number 1, start exercising. If you don't, here's what happens. When your insulin comes out, it takes the sugar in your blood and takes it to the nearby cell and goes to put it in the cell and get it out of the blood and lower your blood sugars back into their norms, okay? That's why it was sent for. If the cell is so full because you have not exercised for some time, then it's going to resist the insulin and not let it put the sugar in. When the blood builds up with a lot of sugar, it doesn't flow very good. When you mix water and sugar and heat it to 98 degrees, you start to create something called syrup. Okay? It's not going to be able to pump very quickly. So you got to get the sugar out of the way. It makes perfect sense. The body wants the sugar anyway. It's its natural source of energy. But here comes the sugar. Here's the cell. The cell hasn't moved, hasn't done anything, hasn't taken any action, particularly exercise for days, weeks, and maybe months. And so it's still full from all the other times it's got sugar, and it says no to the insulin. So the insulin says, well, I'll show you, and calls for a backup, and it forces its way in. All right? Well, the cell then gets a little angry and builds a resistance to 2 units of insulin. So the next time when 2 shows up, it can't get in again, so it calls for backup. It takes 4 this time, forces its way in. So this battle is going back and forth, and it's called insulin resistance. And as it gets high enough, suddenly the pancreas can't produce any more insulin, so game over. You're a type 2 diabetic, all right? So they're going to put you on some meds. They're going to artificially bring down your insulin resistance. That's going to work for a few years, and you're going to feel a whole lot better. But a couple of other things are creating a problem here. High amounts of insulin means your body won't drop weight. That's right. It's a hormone that stops your body from utilizing fat as a fuel. So high amounts of insulin in the body, you're going to, and of course the doctor says you got to lose weight. Well, you're increasing your amount of insulin, you're in a big fix, all right? Here's a couple of ideas. Exercise. That's novel. And I mean exercise every day. It would be ideal if you could spend a minimum of 5 hours of exercise per week. If your life is worth that much to you, you ought to invest that much in yourself. 5 hours per week of just walking would make all the difference in the world, because you'd utilize up that fuel. The next batch that comes, lots of room, let it in. Okay? Exercise primary. Second, do me a favor. Get to your computer. Do a Google search. Look up something called the Glycemic Index. That means how quickly does a food break down and enter the bloodstream in the form of sugar. Glycemic Index, okay? There are foods that look very innocent that are your worst enemy. Innocent foods such as potato chips, French fries, Hot Pockets, Lean Pockets, pizza, white bread. It breaks down with a few chemical reactions and immediately floods your bloodstream with, yes, sugar. Turns to glucose, of course, that's what it's called. And suddenly it's too high and out come the insulin to protect you. All right. If you will eat, and you can print this out, high glycemic, medium glycemic, low glycemic. For a person who has a tendency towards this disease, high glycemic foods are off the chart. They're poison, okay? Just don't go there. Medium, yes, use them sparingly. Low, that's your food. That's what you live on. So once you understand the glycemic index, now start picking your foods from down here. Now another thing you're going to find out is even our good-for-you foods. Let's say it was a salad, but the salad had things like carrots and peas and corn and beets. Every one of those are high in sugar. Or let's say it's a fruit, even just an apple. It's high in sugar. Well, those high sugar foods, you've got to lower and take them in smaller amounts. If we would eat 4 or 5 small meals a day, we would change up our blood sugar issues overnight. Okay, that's why as soon as you've become a diabetic, your doctor's going to put you on what is called the diabetic diet, which is 4 to 5 small meals per day. And make wise choices of what those meals are. All right? Understand one thing. Insulin saves your life by taking the excess sugar out of the way. But in doing so, it helps break down the cardio system dramatically. And it is one of the main causes of the cardiovascular disease. And that's why you want to be insulin sensitive, eat 4 or 5 small meals a day, watch the glycemic index, and cleansing and dropping weight have an incredible impact on all of those numbers. Have your doctor monitor them. Most of my 1,000 friends are at a point that the doctors are elated. They've taken off the extra weight. They're eating their 4 to 5 balanced meals a day, and they're doing marvelous. Their numbers are in the right range for the first time, some of them, for a long time. But it's not because it cured their diabetes. They're still diabetics. But they're managing it, all right? A couple of things that I do differently with my friends who have this challenge. One, I suggest that they take that protein shake, which is a large meal, and it does have fructose in there, which means it's sugar. And if you break it into 2 small meals, in other words, a single scoop shake, wait 2 hours, mix the second single scoop shake, your blood sugar will probably do a little blip rather than a big rise. Makes a huge difference. I also suggest for my friends with this challenge, you only cleanse 1 day per week rather than do a double day cleanse, partly for this reason. Many of my friends with high blood sugar also have the opposite side of low blood sugar, hypoglycemia. And when you try to cleanse 2 days in a row with a person with low blood sugar, you're lowering it down already, you can get yourself in a little trouble there. With a little bit of experience and learning how to snack in between the cleanse juices, you can finally get to the point that you could cleanse maybe even deeper for 2 days. But those are just a few good hints. May I tell you, of all the groups that I've worked with, the 2 groups that get the biggest impact from the cleansing technology and the isolene shake technology is my friends with blood sugar issues and my friends with digestive issues. It seems that it balances out both of those faster and better than anything else I've seen or used. So good luck to you in your future if you've had any of these challenges, and if you haven't, you may know someone who needs to know this information. Introduce them to the cleansing and replenishing technology of the Isagenix program. Thank you.